guest on the Nightcap on this Tuesday evening on 700 WLW is someone we have talked to before. You may be familiar with his work or our conversations. He is a managing partner of PCS Advisers. They work with the healthcare industry, and that means you and people who provide healthcare, amongst other things. His name is Paul Seegert, and he is here right now. Paul, good evening. How are you?
Doing great. How are you today?
Fantastic. Tell me something about PCS Advisers first and what you guys do.
We show employers, who I think are the only stakeholders that we can all count on to fix this healthcare system that we have, or at least the way we pay for healthcare, because that's the only real problem. We work with those employers to demystify the system, get transparency into what's going on, and get better results for themselves from a cost standpoint and for their employees.
Well, very
about half the national average for healthcare.
About half the national average. That's good. I mean, that's a very positive thing, because there have been all kinds of new opportunities for people to scam and gouge during what I call the great scamdemic of 2020 and 2021. Anytime there is a time of crisis and people are afraid and people are scrambling to make sure their health and their health care is protected, there are always vultures around. And this is highlighted by this latest story of a man who had health care through healthcare.gov, the Obamacare exchange. And back in June of 2020, he wanted to get a PCR and antigen test for COVID for himself, and it wound up being charged to the tune of $56,000 plus, $54,000 alone for the PCR test, which is the more reliable of the two. But the thing was, he was out of network, I guess, from his health care. What I was remarking about when I saw this story, Paul, is that all through the scamdemic, we've seen all kinds of free COVID testing all over the place. How can something that is free somewhere as you're driving through in your car cost $54,000 somewhere else? That's my question.
Yeah, it's the bad acting provider in this case, certainly not acting in any kind of good faith to our overall system. What we have an unintended consequence here of some of the CARES Act, that where the intention was to make it so that consumers wouldn't have to pay out of pocket for treatments related to COVID, including these tests. That created an opportunity for some of these less ethical providers to say, okay, well, shoot, the consumer's not going to pay a copay. They're not going to have a deductible expense, so they're not really going to care what we charge their health plan.
Yeah.
Let's just charge as much as we want.
Let's gouge their eyes out on the back end.
Let's do it. So in this case, $56,000. We've seen the same thing with hospitalization charges, where you can have two people going to the same hospital, and I mean, it can be multiples of one person's charge can be a small fraction of the others for the same services based on whatever their health plan is and what's negotiated. So it's putting a nice spotlight, I think, on a problem that's happening millions of times a day with all kinds of procedures. And it's a pretty disgusting example of how players in our system will take advantage.
At this point, the provider in question here in this case, the insurance company, Molina Healthcare, said this matter was a provider billing error, which Molina identified and corrected. So, yeah, when the provider is charging these outrageous sums, then the insurance companies obviously are going to get their say. And you know what? We're not covering this. And obviously the person who's insured shouldn't be covering this. Number one, how important it is for you to know, as someone who needs, whether it's an emergency service, especially an emergency service, how important it is for them to know if this provider is in or out of their network.
Well, it's very important in general. And what we have in this particular example is that because it was out of network, then the rules are even more favorable to a provider that wants to act this way, because they don't have a pre-existing contract with this insurer, so they can just charge whatever they'd like. and then the insurer, and then there's some negotiation that incurs and so on. And then in this case, they settled on a reimbursement of $16,000, which is still a disgusting charge when you consider the fact that you and I could buy this.
That's still $38,000 that they're on the hook for.
Well, in this case, the consumer didn't pay anything, but the insurer paid $16,000.
Okay, so
after it was all settled out.
The $54,000 went down to $16,000.
That's right.
This is important too. If you can, as a patient or someone who needs the services, negotiate. This has been a long-standing argument, Paul. If you can negotiate your rates with the person who's providing the care, it quite often will come down from the original billing statement, right?
It can, very much so. Especially if you were not to use your insurance and you just were to go in and say, "Hey, I'm going to pay cash for this." Shockingly, what you'd find for so many procedures is that they would all of a sudden charge you 80 to 85% less than what they were about to charge you when they felt they were going to hit your insurance company for it. And that's a big part of the problem that we're facing in our system, the fact that they're hoping that consumers will only care about their portion of the bill and not make the connection that the fact that you're overcharging me when I'm insured is translating into these big renewal increases that are hitting me every year that are outpacing now my wage increases and everything else. It's inflating costs throughout the whole system.
Well, the person in this particular case, a young man named Travis Wagner, was he the one that saw the charge and flagged it and got in touch and started playing phone tag with the ER and the insurance company and everything else?
He is, and what a great thing that he did, despite the fact that he was held harmless.
Yes.
He was still incensed by this whole situation, thinking correctly that it's not right, and while it may not cost me right now, it's going to cost me and everyone in the system that this is going on.
Well, certainly.
So it's great that he did this.
It is estimated, by at least one estimate, that 3 to 10% of healthcare spending in the U.S. goes to overpayment,
right,
including fraud, waste, and abuse. How can we have this many charlatans involved in healthcare in this country and have any modicum of trust in their credibility?
It's the perfect question. It's the one that we need to address. How is it that our system allows for this? I'll give you a quick example of how it occurs. You have, and why this occurred, you have auto adjudication of claims. You'll have the big insurance brands that we're all familiar with. There's only a handful left. The Blues, the Uniteds, the Cignas, the Aetnas, Humanas. They'll tout their auto adjudication rate, meaning when a claim comes in from a provider, it gets auto processed. The computer's just settling this claim, applying the discount, and the check goes out or whatever, a reimbursement. Well, that's resulting in this error rate that you talked about. It can be as high as 17% for some of these insurers, and it results in a 4 to 5, 6, 7% overpayment across the board. But there's nobody watching the till, and these providers have figured that out. We've done claims audits on larger employers, and we'll find cases where a hysterectomy gets billed twice on the same person, which is not possible, of course, and it'll get paid twice. Or you'll have a man go in for a physical, for the annual physical, and they'll bill a pregnancy test, and it's just getting auto-adjudicated. So there's a certain point at which automation actually works against you, especially when it creates this moral hazard, and providers figure out they can essentially send you whatever you want, and you're going to pay them.
Auto adjudication may be faster. It's certainly not cheaper. Right. Streamlining the system there. So let me ask you this, Paul. If Joe Biden's vaccine mandate through the Department of Labor ever gets through, and there's a lot of cause to believe it will not last in the court systems, I think you would agree with me. There's an awful lot of court battles to come on that, right? For employers,
it's going to be a very interesting coming few months.
Employers of 100 people or more, especially if they have government contracts requiring people to either show that they've been, quote unquote, and I put it in quotation marks because I don't believe it's a vaccine, vaccinated, or a test, a negative COVID test once a week. And this goes directly to the cost of testing and who pays it and who is going to pay it as they write the rules right now. And if you've got certain ERs, rogue ERs charging $54,000 as they did in the case of Travis Wagner's simple PCR test that were given out free willy-nilly all over the country in drive-through testing sites. So the question remains, all right, who, number one, is on the hook for the testing cost, and why is it costing so much if they were willing to do it free at the outset before the vaccine?
Right. When you look at the real cost, if you wanted one of those antigen tests, which is kind of the faster version and a little bit less accurate and a little bit cheaper, it's a $15 or $20 test. You and I could source it at that cost, one at a time.
Oh, yeah.
And then you have these other tests, the PCRs, that are $115 or $20. So, but it still begs the question, who's going to pay for it? And when it comes to, it's a pretty clear answer from the insurance world. They're not going to pay, health insurance companies are not going to pay for testing that's for a mandate. They'll pay for diagnostic testing at the request of your doctor, but they're not going to pay for it in the case of supporting an employer mandate. So then is it going to be employers or employees? And I have a hard time believing that when we finally get our hands on this ultimate ruling, that it's going to stay in there that the employees are going to bear the cost. So then you have employers, many of which are coming out of some pretty tough times.
So you got employees.
Out, how am I going to pay for this?
Okay, the antigen test, which as you mentioned, is less accurate but is much quicker, and that's probably going to be the most reliable as far as this weekly testing mandate. It could cost you $15 or $20 a week. If it's a PCR test, it could cost you at the minimum $120 a week. Who can sustain that? Most people I know cannot. But I mean, $15 or $20, you could say, well, I'll suck it up as long as I don't have to get that shot I don't believe in. You know?
Right. Well, yeah. And will they even make it available? I think if some employers are faced with if the rule comes out and says the employer is going to shoulder the charge, some of those employers might say that I'm going to make my mandate more strict, and some out there in our world believe maybe that was the intention. But then I'm going to make it more strict because I can't shoulder that cost, so we're just going to say vax or work somewhere else.
Well, what's the balance, Paul, between 10th Amendment issues like the state of Texas and the state of Florida? The governors have already signed these executive orders. In Florida, you can be fined if you mandate vaccines and you're a company. In Texas, the governor signed the executive order, Greg Abbott, just a couple of weeks ago that said you're not allowed, it's illegal for you to force a vaccine mandate on anyone by any entity. So we've got another federal court fight coming up between the feds and the states.
We definitely do. Yep, it's already happening.
Yeah, I know.
And you already have employees, even before the announcement from the president, that were saying, hey, I've got natural immunity, I'm a law professor, or I'm a doctor in the UC system in California. There's numerous interesting cases that we're watching play out where they're saying, look, I've got natural immunity. There's a whole body of evidence that shows that is as good, perhaps better than what I was.
No, there are studies over and over again from Israel and all over the world that show that natural immunity, acquired natural immunity, and natural T-cell immunity. There are some people who have immunity before they even got the infection, and it's been proven over 80% of people are asymptomatic when they get a COVID infection, and a great percentage of those people never actually had COVID because their body just sheds it off as soon as it's exposed to it.
Right.
So, I mean,
so there's a real basis for that one.
Yes.
I think those folks, it'll be interesting to see how that plays out.
I believe I'm one of those people. Now, my wife, we know, when we didn't even get the test, we know she had COVID-19 almost a year ago in early November because she was on her back for a week and a half with no energy, body aches, and loss of sense of taste and smell. She didn't really spike a fever, but she had all the other symptoms of classic COVID as we know it in 2021. And I was in the same room with her. I kissed her every day. I went out and did shopping for us and whatever. I I wasn't trying to expose anybody to anything, but I never exhibited symptom one. And, I just believe blood type or whatever, I have natural T-cell immunity to this particular virus. She had it, and I know that it's real. I'm not a denier here, but yeah. I know that she also has natural immunity now that can last, in some cases with viruses, it can last as much as 19 or 20 years. I mean, once you have chickenpox, you don't have chickenpox anymore.
Right.
And this isn't chickenpox, I understand that, but it is a fact that viruses, it's virology 101, I've been told by doctors who are in the know and who don't have an agenda or being paid by someone from the government or the big pharma to say so. They say that natural immunity, acquired or natural, is way, way better than any kind of spike protein shot they can give you.
Well, there's many solid studies, many of which were done in this country by very respected institutions that would support that. And I think that will give basis to some pretty good arguments in court, and we're seeing those happen right now.
Well, since you were managing partner of PCS Advisers, how are you advising companies on this particular issue? What would you say to them?
Well, that's the challenge, is that they've added more confusion to this whole conversation with some of this top-down discussion of a mandate. And then you have the administration coming out saying, get ahead of the mandate, partly because I think they see that there could be some legal hurdles to get this thing through.
No doubt.
Get ahead of it. But then we have employers telling us, how can we get ahead of it? 85% of the employers out there before this presidential mandate were telling us that they had an intention of having some sort of policy around this by the end of the year. So there was already momentum for that to occur. I think those policies would have been in many cases more accommodating and more practical. Kettering Health in your state, as an example, was allowing for an exemption based on natural immunity. And then when this came out, it kind of was, I think, changed the conversation and put the brakes on a lot of that trend, because now you have employers that are in the wait and see mode. They don't want to spend a bunch of money implementing something that they then have to dismantle and change. And so that's our advice, is you kind of have to wait and see.
It's odd to me, Paul, talking to Paul Seegert from PCS Advisers, on the cost of some tests that are given out free to some people and being charged $54,000 to some others, depending on whether they're in or out of their networks. But, Paul, I got to tell you, it's no surprise to me that when Joe Biden issued this edict, which may or may not be constitutional, we'll see what the courts decide, he talked about employers of 100 people or more. Who was hurt most by the planned or scamdemic? Small employers of less than 50 people. So there are fewer and fewer of those out there. And the big boys have not only survived, but thrived in many instances because they've been shown favoritism by the government, I believe. Paul Seegert, thank you so much for your time tonight, and I appreciate you bringing this story to light to us.